Hey everyone! Today we're diving into an important health topic, diabetes. It's a condition that affects millions of people worldwide, but did you know that there are actually different types of diabetes? In this video, we'll be breaking down the differences between type 1 and type 2 diabetes, how each type develops, and, most importantly, practical steps you can take to prevent diabetes. Whether you or someone you know has diabetes, or you're simply looking to live a healthier life, this information can be essential for understanding and managing this common condition. What is diabetes? Diabetes is a condition where your body has trouble managing blood sugar levels, also known as blood glucose. Normally, your body uses a hormone called insulin, produced by the pancreas, to help glucose enter your cells for energy. With diabetes, however, this process is disrupted, leading to elevated blood sugar levels. Over time, high blood sugar can damage various organs and tissues in the body, leading to complications such as heart disease, kidney issues, and nerve damage. Understanding how diabetes affects the body is the first step in recognizing why proper management and prevention are so important. Type 1 diabetes. Type 1 diabetes is a chronic autoimmune condition in which the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. As a result, people with type 1 diabetes have little to no insulin, a hormone essential for allowing glucose to enter cells and provide energy. Without sufficient insulin, glucose builds up in the bloodstream, leading to high blood sugar, which can cause serious health issues over time, including damage to organs, nerves, and blood vessels. People with type 1 diabetes must take insulin injections or use an insulin pump to manage their blood sugar levels, as their bodies cannot produce the hormone naturally. Type 1 diabetes is typically diagnosed in children, teens, and young adults, although it can occur at any age. The exact cause is unknown, but it is believed to result from a combination of genetic and environmental factors, possibly triggered by infections. Unlike type 2 diabetes, lifestyle factors like diet and exercise do not cause type 1 diabetes. Symptoms of type 1 diabetes can develop suddenly and include excessive thirst, frequent urination, sudden weight loss, extreme hunger, fatigue, and blurred vision. Managing type 1 diabetes involves regular monitoring of blood sugar levels, administering insulin, and maintaining a balanced diet and exercise routine to stabilize blood sugar. Though there is currently no cure, research is exploring ways to prevent or delay its onset through immunotherapy and artificial pancreas technology. Despite the challenges, with careful management, people with type 1 diabetes can lead full, active lives. Type 2 diabetes. Type 2 diabetes is a chronic metabolic condition characterized by insulin resistance, where the body's cells become less responsive to insulin, or by inadequate insulin production by the pancreas. Unlike type 1 diabetes, which is an autoimmune condition, type 2 diabetes is primarily influenced by lifestyle factors such as diet, physical inactivity, and excess body weight, though genetic predisposition also plays a role. This form of diabetes often develops gradually, typically in adults over 45, though rising rates of obesity have led to an increase in type 2 diabetes among younger people, including children. In the early stages of type 2 diabetes, the pancreas compensates for insulin resistance by producing more insulin. Over time, however, it becomes harder for the body to maintain adequate insulin production, leading to higher blood sugar levels. Symptoms of type 2 diabetes may be subtle and develop slowly, including increased thirst, frequent urination, fatigue, blurred vision, and slow healing of wounds or infections. Many people may have prediabetes, a precursor to type 2 diabetes, for years without noticing symptoms. Managing type 2 diabetes often starts with lifestyle changes, such as adopting a balanced diet, increasing physical activity, and achieving a healthy weight. These measures can significantly improve blood sugar control and may even reverse prediabetes. In some cases, medications like metformin or eventually insulin therapy may be required. Type 2 diabetes is preventable in many cases, and early diagnosis and proactive lifestyle changes can reduce the risk of complications like heart disease, kidney damage, and nerve issues. With proper management, individuals with type 2 diabetes can live healthy, fulfilling lives. Key differences between type 1 and type 2 diabetes. Understanding the key differences between type 1 and type 2 diabetes helps clarify why their management is so different. Type 1 diabetes is an autoimmune condition that requires insulin for life, while type 2 diabetes is often linked to lifestyle choices and can sometimes be managed without insulin. Type 1 diabetes tends to develop in younger individuals, whereas type 2 diabetes usually appears in adults, though it's increasingly seen in children due to rising rates of childhood obesity. While type 1 diabetes comes on suddenly, type 2 develops more gradually, making early detection and lifestyle intervention crucial for management. Can diabetes be prevented? While type 1 diabetes currently cannot be prevented due to its autoimmune nature, there is ongoing research into ways to delay or possibly prevent its onset. Type 2 diabetes, however, is often preventable through lifestyle changes. Taking active steps to lower your risk of type 2 diabetes can significantly improve your long-term health and potentially prevent other associated health issues. Let's look at some effective ways to prevent or manage the risk of type 2 diabetes. Eat a balanced diet. Eating a balanced diet is one of the most effective ways to lower your risk of type 2 diabetes. Focus on whole foods like vegetables, fruits, whole grains, and lean proteins, which help stabilize blood sugar levels. Limiting sugary drinks and processed foods, as well as choosing high-fiber options, can help keep your blood sugar in check. Fiber, in particular, slows the absorption of sugar, helping to prevent spikes in blood glucose. Stay active. Regular physical activity is essential in preventing type 2 diabetes because it helps your body use insulin more efficiently. Aim for at least 30 minutes of moderate exercise, like walking or cycling, most days of the week. Physical activity not only helps maintain a healthy weight, but also improves insulin sensitivity, meaning your body requires less insulin to process blood sugar effectively. Maintain a healthy weight. Carrying extra weight, especially around your abdomen, can increase your risk of developing insulin resistance. Even a small weight loss, around 5 to 10% of your body weight, can make a difference in improving insulin sensitivity and lowering your risk of type 2 diabetes. This is why focusing on a healthy diet and regular exercise is so important for prevention. Limit alcohol and quit smoking. Both smoking and excessive alcohol consumption have been linked to an increased risk of type 2 diabetes. Quitting smoking and moderating alcohol intake can not only reduce your diabetes risk, but also improve your overall health. Smoking, in particular, has been found to increase insulin resistance, making it harder for your body to manage blood sugar. Get regular checkups. If you have a family history of diabetes or other risk factors, talk to your doctor about regular screening. Early detection of prediabetes can help you take action to prevent type 2 diabetes from developing. Regular checkups are a good opportunity to discuss lifestyle changes and monitor blood sugar levels before diabetes becomes a concern. Understanding the differences between type 1 and type 2 diabetes is crucial in managing and preventing this condition. While type 1 diabetes cannot be prevented, type 2 diabetes is often avoidable with the right lifestyle choices. Simple steps like eating a balanced diet, staying active, and getting regular checkups can make a big difference in your overall health. Thanks for watching, and if you found this video helpful, please give it a thumbs up, share it, and subscribe for more health insights.